In this episode of the Nurse Practitioner Videocast, Chelsea Willmott discusses NP practice in New Zealand. Thanks so much for your time today, Chelsea.
No problem. Good morning, and I believe good afternoon for you guys.
Can you please tell us what it's like to be an NP practicing in New Zealand?
Absolutely. So being a nurse practitioner practicing in the beautiful Aotearoa, New Zealand is probably just the best word to describe it is amazing. We have two islands, the North Island and the South Island, and then another smaller island, so technically three, Stewart Island at the bottom of the South Island. And nurse practitioners in our country work across all contexts and across all different clinical areas. And it's just, it's an absolute privilege to work in this role.
What has your professional NP journey looked like thus far, and what would you like to see in the future of your career?
So my personal nurse practitioner journey in New Zealand, to become a nurse practitioner, you need to first of all have a Bachelor of Nursing degree and then a master's degree. So for me personally, I became a registered nurse first, and I worked in the emergency department, which I believe over in America is called the ER. And so I became, sort of got my foundation within that setting, that acute setting. And then I started doing a range of different contract roles across rural Australia as well as rural New Zealand. And then I sort of settled in a small town, rural town in the middle of an area of New Zealand called Central Otago. Our biggest town is Queenstown, which is about an hour away from where I am, and I live in a small town called Wanaka, very beautiful. You might have heard of the Wanaka tree. It's quite famous thing to take pictures of where I live. And so my clinical work became more rural based. Our closest hospital is 3.5 hours. We use the helicopter service a lot. So I was working in as being in rural, my role became, more autonomous than it would have been if I was working in a city. And through that journey, I saw a nurse practitioner, a nurse that I worked with become a nurse practitioner. She's very inspiring to me. And at the time that I decided to become a nurse practitioner, I was actually working between academic work and clinical work in the Bachelor of Nursing degree and in some of the postgraduate courses. So I was actually completing my master's degree with a research-based dissertation. And I realized that I wanted to become a nurse practitioner. I wanted to be able to do both the nursing component and the biomedical model component. So I actually had to do some additional courses, postgraduate courses on top of my master's degree. And then I completed the National Nurse Practitioner Training Program through Auckland University, and then became a nurse practitioner. And now I still work between clinical work. I work in rural primary care, which incorporates general practice. I believe in America it's called family practice, and I also work in emergency and urgent care, just given the nature of the setting that I'm in. And then I still do work in the academic world. I currently work within the National Nurse Practitioner Training Program, and I'm also the chair of Nurse Practitioners New Zealand, which is our professional organisation. So I have some varied roles, but I absolutely am so pleased that I went on to become a nurse practitioner. It has been such a rewarding role, as I'm sure that many of you who are nurse practitioners feel the same.
What is the future of NP subspecialties for New Zealand?
So the future is bright for nurse practitioners and subspecialties. At the moment, so initially when the nurse practitioner role began in New Zealand, nurse practitioners were registered into their specific area of practice. So that may have been family, general practice. It may have been a certain restriction with the age of patients that you saw. Maybe it was mental health and addictions. Maybe it was a specialty service like cardiology. And those restrictions by our regulatory body, which is the Nursing Council of New Zealand, those restrictions were lifted some time ago. So at the moment, what we offer nurse practitioner candidates is a generalist training program. So what that means is that you will have a cohort of very, very keen expert registered nurses who all come together, and they may be from very different areas. So you may within one cohort have mental health, somebody from mental health and addiction, somebody from cardiology, somebody from primary care, somebody from respiratory, somebody from aged residential care, and they come together in this in our national training program, and we teach a generalist model, which is a a blend between nursing sciences and biomedical. And what we want is consistency across our workforce so that everybody who is a nurse practitioner is approaching their foundational assessment and diagnosis process in the same way. And then they're taking that core foundational model of how they practice, and they're taking it back to the different areas that they work in. So as I said, we've got this national generalist training model. What we don't yet have established is specialty pathways. So we know that we might have a nurse practitioner candidate from cardiology who has done various postgraduate qualifications, who's definitely a specialist within cardiology. But when they become a nurse practitioner, they are then again a novice as a nurse practitioner in cardiology. And what we do need for our workforce is to look at how we can actually build specialty endorsement processes through each of the specialties, and then what that looks like in terms of what would a new nurse practitioner candidate in cardiology, function like, and what would somebody who was very experienced function like, and therefore what are the additional education pathways that we can build into that specialty to create clinical fellowship opportunities, and again looking at the health needs of the population and how can we make an impact around taking on more interventional procedures if that's warranted, looking at redesigning models of care that we can work within to tackle some of the challenges that our population has around wait times, around access. So we really are in a very exciting time in Aotearoa around looking at how we can really develop our whole workforce and the future of our workforce, because not only do we need to have more advanced nurse practitioner roles integrated into our health system, but we also need to provide job opportunities and different ways of being able to advance your career once you become a nurse practitioner. So that's a really big project that we are just starting to work on now. And part of our development process will be researching many other models from around the world and looking at how things are done elsewhere, and then looking at our context and working out what's going to suit our national workforce.
Thanks again for sharing those insights. Are there any past or present roadblocks or advocacy issues you'd like to address?
Yeah, so we have had a substantial amount of roadblocks for our profession, certainly in the first, the first sort of 15 years of our profession's introduction into New Zealand. We had to lobby at many motivated and fantastic nurse practitioners got together and lobbied and really tried to break down the barriers to have legislation change so that nurse practitioners were able to practice to their full and intended scope. We've had multiple successes along that journey, and we're very grateful to those nurse practitioners who were able to really make some significant changes for us and remove barriers. Now we are in a position within our profession where, as new legislation gets written, nurse practitioners are being included and thought of initially in that wording, which is absolutely fantastic. We've got some historical pieces of legislation that still provide several restrictions for us. One of those is within the Medicines Act, which the previous government wanted to move to a new piece of legislation called the Therapeutics Products Bill. The current government, the new government, is going through a repeal process, and within that piece of legislation, we have this area called Section 29, which still refers to medical practitioner only. So we are working hard to try and remove that barrier. It's one of the last barriers, and it pertains to certain medications that really do inhibit the ability of nurse practitioners to be able to work to their full scope. Nurse practitioners in New Zealand are autonomous. We don't have agreements with physicians. We're able to be lead care providers and offer an autonomous healthcare service, and that is, such a fantastic thing, because I understand that in America there is different rules in different states, and I can understand how challenging that would be. We don't have that here, but we also have another restriction, which is around primary care nurse practitioners not being able to order the first pregnancy ultrasound. That legislation still sits with midwives and medical doctors. So we still have some work to do. There's also many other things coming up for us to tackle as our workforce gets bigger. We've got to build stronger relationships with primary care physicians. We've got to work on our relationships with across the sector. We're seeing that nurse practitioners who are integrated into specialty teams in hospitals have a very well supported role, and their acceptance within the medical teams is, so far has been fantastic. In primary care or family practice, because the nurse practitioner role offers a similar role to that of a general practitioner, there is, as you can imagine, there is a lot of tension in that historical things that come up from nurses versus doctors. And so we've got a lot of work to do there. We also have to continue to showcase our role. We still, we have relatively small numbers. Our population is just under 6 million across New Zealand. We have most of that population living in the North Island, and comparative to that population, we've got around 82,000 nurses, and we have within that, we have about 3,000, just under 3,000 registered nurses who prescribe, and then we have 800 nurse practitioners. So in terms of the challenges that we face with barriers, we are still quite small, but we are growing rapidly. As I said, our national training program now offers around 123 to 25 funded training places every year. And Health New Zealand have signaled that they'd like to increase the funding for that, so we're able to offer more training places. So it puts us in an interesting position with a very rapid influx into a relatively small workforce. And with that, we have to do the work to be able to help patients understand what nurse practitioner is, how it's different to registered nurses. And in New Zealand, we have registered nursing roles who have prescribing rights. So patients and our allied health colleagues and other colleagues can get confused around what is the difference between a registered nurse with prescribing, a clinical nurse specialist, and a nurse practitioner. So we have a lot of work to do. And as I said, in my role as chair of Nurse Practitioners New Zealand, not a week goes by without a new big thing coming in that we have to tackle. So we're taking it as it comes, and we're also still continuing to put pressure on and make change where we can and where we need to.
Do you have any closing thoughts you'd like to share?
I'd like to let you all know that we would love to get to know you more and to be able to share ideas. And we have a conference every 2 years. This year it's in October in Rotorua, and we would love to invite any of you to come along. And if you're interested in learning more about our nurse practitioner programs or how the role functions across New Zealand, please reach out. We'd love to connect and say hi. And we hope that if you haven't visited New Zealand, that that you'll put it on your travel list one day. It's a fantastic country with great beauty and lots of wonderful things. So yeah, that's about all I've got to add.
Thanks again so much for your time today, Chelsea.
No problem at all.